Peter, are there specific psychotherapy methods or I'm thinking of cognitive behavioral and acceptance commitment therapy
Yeah,
and those type of things. Are those the pieces that build what you're including
it's
in with?
partly that. But I think there's a missing piece in the psychological therapies because a lot of them are very much talking therapies. I think the piece that's missing is that we embody our fear. Like fear is not just in the head. You might be frightened, but actually we embody that. That's in the body. So we know, for example, that if someone's frightened of bending, they overcontract the muscles to protect themselves from bending. Mm-hmm. So we will often address people's fear through their body, through relaxation techniques and through movement rather than talking to them. And so the research that's coming through now is showing the powerful role of behavioral learning. So behavioral learning is learning through doing, through your own experience. And so what we're finding is you can't talk someone out of being frightened to get on a plane. You got to get on a plane. Or you might do simulation work to be in a plane. And then you grade that up to learn to get, confident to get in a plane. You can't just say, I'm going to talk you into getting on a plane because it doesn't work. So there's a lot of evidence emerging around fear and fear-related pain that actually it's the behavioral experiments that's the key. So we have to be pretty skilled doing that because if you, for example, someone who's frightened of forward bending and you just go, no worries, just do it, and it blows them up, that makes their fear worse.
Sure.
Right? So you have to be very skilled to expose someone to something that's scary. Number one, making sure that they don't have pathology, because then that's the wrong intervention, right? Mm-hmm. Like then to take them through that journey where actually they develop pain control, that they're thinking my back's going to be stuffed if I bend and touch the floor, but actually bending and touch the floor now actually feels okay. So now it tells me that it's safe to bend. So the behavioral experiments or behavioral learning is a key foundation that I think is missing within the psychological therapies. Mm-hmm. They talk about it in general terms, but not the embodied component. And I think that's probably, like, we see that as very important to our work. In terms of other aspects around ACT and commitment therapy, I think goal-oriented care is something that every human being should be, every healthcare practitioner should be driving their patients to. It's like, if you want to, we know that human beings who, seek to achieve their goals are the happy ones. The patients who send me photographs and cards and gifts, they always tell me about something that they have done that they thought they couldn't do. Yeah. I climbed a mountain. I've gone skiing. I've started running. I'm playing. Like I had a guy this week sent me a picture of him hitting a golf ball. I never dreamt I would again hit a golf ball. Thank you for helping me get to my goals. That's what ACT and commitment therapy is. I think there's a missing link there though, and that often they ignore the person's pain and drive them to function. And I don't think that's right. Patients want pain control. Patients look for pain relief. And what we see within our approach is you'll see an improvement in function and a reduction in pain that often goes hand in hand. To me, that's what they want. That's what they're looking for. So I think you can't ignore a person's pain and suffering and just drive them to do the stuff that they're looking to do. I think you need to consider those factors at the same time.
Certainly, I agree that the forward bending piece with low back pain, chronic low back pain is a very common finding that patients are scared of.
Terrified.
On occasion, terrified of it. On occasion, you'll find someone that can bend, but they can't straighten up all the way.
Correct. Yeah.
So in the same way,
totally. Yeah. So I got a guy yesterday, forward bending's not a problem. Backward bending, he's terrified of it. So you'd use exposure to backward bending, no different.
Graded exposure.
No, you'll see some people where it's not forward backward bending, it's twisting. They're frightened of twist, or it might be side bending and twisting. Then that's the same thing. You're looking at restoration and movement in a three-dimensional movement system, which is the spine. For some people, it's loading. For others, it's just to stand or to sit. It's got nothing to do with, and it might not matter what posture they're in. They're just frightened to do it.
Yeah. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.